disability team. Officially, it's called Preparing for Adult, what I do, but actually, I think we're going to call that Transition to Adult Social Care today, because I think it just sounds a bit more like what we do. So the principle of transitioning to adults is that we look at 4 key pathways for young people. So these pathways were decided by the young people. There was lots of research, and there was lots of workshops with the young people who decided that it's these 4 pathways that actually make up a meaningful life. So a good, meaningful and happy life. And that's what the research told us. So the 4 pathways are made up of employment, independent living, community inclusion, so that could be peer groups, friendships, hobbies, and general interests, and health. A lot of the research indicated that young people with disabilities weren't as healthy as they could be, and a lot of work was done around making sure that everybody has got access to good health care. So just looking at each of those 4 headings, so just to consider why the pathways are important, we have to hold in mind that it's important that we give young people with disability the same opportunities, and they have the same rights as typical young people. And that's a key ethic of the PFA and transition to adult thought process, and what we're actually trying to achieve for young people. And what we centre on and what we focus on is really trying to find out what the child or young person's aspirations are, and what's important to them and what they're looking for in the future. So whether that be that they've got a good social life with their peers, or whether they're able to achieve employment, or whether they're able to achieve voluntary work, just making sure we're finding out what they want so we can support them to achieve it where possible. So what I do generally is I start working with young people from year 9, and it's a team around the young person. So I will start off by attending their EHCP plans, which I believe used to be called the statement meetings. So I'll start by attending those meetings once a year, so I can get to know the young person, and we can start thinking about what subjects they'd like to study and what type of provision they might like once they reach 18 or 19 or 20 when they do leave education. So we also look at independent living. What we're doing at the moment in Havering is we've got a quite a shortfall of independent living properties available. So a site has been commissioned in Havering, so that we are building more housing for those that need independent living support and for those that need wheelchair friendly support, and those will be ready within the next couple of years. Unfortunately, it does take a long time to bring these types of things together, but Havering is definitely working towards it. The other thing that we look at is looking at friends, relationships and community involvement. So we're looking at supporting how young adults can stay in contact with their peer group from college or from school. And we're looking at how we can use community resources to support friendships and develop new friendships. So a really easy example of that is that we had a group of young people that were leaving one of our colleges last year. So what we did, and all of these young people quite like the idea of going to a daycare provision. They quite like the idea of going to the same place where they felt quite familiar, in a familiar setting and with familiar staff, with trips out into the community as and when. But what we did is that we made sure that those young people were attending a daycare provision on the same day. So I think what we did was we made sure that they were all there together on a Wednesday and a Friday, so that they could maintain their friendships from college and yet have the opportunity to develop new friendships with the other service users. So it's just about being creative and making use of our community. What we do with health is the research tells us that a lot of young people, young adults with disability or learning needs, aren't as healthy as they could be. So what we do is in Havering, you can access our learning disability nursing team, who can support you with looking at things like a healthy diet and how to make healthier choices. They'll also make plans with you, including budgets. And what we can also do is look at doing communication passports if you ever do need health treatment. And what the feedback from our young people is that the communication passport is really helpful because it means they don't have to explain everything each time they meet a new healthcare professional. A few of our young people have got some complex needs and they found that really helpful, and so did their parents and carers. So what we've got in Havering is we've got a multidisciplinary team. So we all work together. So if you are accepted into the community learning disabilities team, you have a whole, you have not only social care, but you get the entire healthcare professional service with that, which is really positive. So you can have access to your learning disability nursing care, psychology, occupational health, which can help with a whole range of issues. The whole ethos behind what we do, the whole principle of what we do is person-centred practice. And I'm not going to go into that too much because I know that's coming up a bit later, but you know, that is the point of what we do as a preparing for adult social worker or a transition to adult social worker. You really need to find out what the young person wants to do, what they enjoy doing, and then help them to plan out some community services and support to make sure that we can support them as much as possible. So this is an example, I don't know if you see that okay, of somebody's perfect week. Now I look at that personally, I think that looks a bit busy for me. I wouldn't want to be doing something every single evening, if I'm honest, but this is a mixture of paid for provision and voluntary provision. So this young person is being supported by family and they have got a direct payment in place to support them with some of these activities. So that's a loose example of what you could look to do with support of your friends, your family that would do it voluntary, and perhaps with a direct payment from social care. So we're looking at the outcomes for each of the pathways. So again, the pathways are health, independent living. So let's look at the employment. So the outcomes for the employment is that we focus on what that young person can do, and typically that's putting together a vocational profile, and that means that, for example, I had a young person that had absolutely adored animals. So what I was able to do was we were able to put together a work profile where they could learn towards learning some skills at college for small animal care, and then towards the end of their education we were able to start contacting some local pet shops and some local veterinary practices, and then we could look to get securing them some voluntary work there. So that's what we're looking for, to get people actually into employment, whether it's voluntary or whether it's paid. So the outcomes for independent living. So what we're trying to do there is in the first instance, we're looking at developing supported living provisions, which is currently happening in Havering, and we expect to have some more provisions available within the next 2 years. And we also support our young adults by providing respite in some cases, so they can have respite away from the home where they're in a supported environment to help them to develop their independent living skills. And we also typically ask that they learn independent living skills as part of their curriculum at college also. So the outcome for friends and community involvement is to ensure that people feel part of their community. The research told us that people wanted to feel like they were part of something, and that helped towards making people feel they were living good and meaningful lives. So what that means is we might support you so that you can attend your local church, or we've got a local club in a local pub in Hornchurch, which attends monthly. So we do support some young people to attend that club. It's a young adults youth club, and as I said earlier, we've supported people that were in college together to attend a daycare provision on the same day, so that they can maintain their contact with their friendships. So the outcomes for health is to ensure that our young people know what a healthy diet is, so they know how much exercise ideally they should be taking each week, whether that's walking or going to the gym, and they understand what healthy food choices are. And then obviously it's up to them to make those choices. I think we all find that quite difficult sometimes. So what I've done towards the end is I've just listed out some local services that we've got. The first one is the CLD team, which is the Community Learning and Disabilities team. I've put in the Haven Carers Hub, which will support you with an entire range of things, from advocacy, benefits advice, housing, respite. They've got a wealth of knowledge, Haven Carers Hub, and they will support you if you're a carer for anyone over the age of 18. I've also listed positive parents, because I work with families that care for adults and children. So positive parents will support you if you are a carer for a child. And I've got there the Haven Association for People with Disabilities. So they, again, can help you with benefits advice and advocacy. And all of these services are free at the point of support. So in terms of what we're doing at the moment and how we're managing in the COVID-19, we have moved as much contact as we can with our service users and our providers to telephone and video calling. So we're maintaining all of our contact with our service users and our providers as much as we did before. And in emergencies and when required, we are still doing face-to-face contact. I've just detailed the CLDT contact number at the bottom, should anybody need it. And then that's the end of my presentation.